My client has developmental asymmetry of the pelvic bones. That's how they grew, because he has normal mobility in multiple directions through the pelvis. There's no restriction for us to correct. And when he sits, his body is a little bit asymmetrical. Well, we did propping under the outside of the left hip, the outside of the right hip, under the trochanter, and we did it under the left sit bone, under the right sit bone. None of that really felt like it enhanced sitting comfort, but as soon as we put it behind him, okay, so this black foam went on the back of the chair. That's when he noted improvement in comfort. And that's when I noted his legs line up more appropriately. Yes, it's subjective. I don't have x-ray eyes. I don't have an x-ray machine, but it's not normative for people to do that anyway when people sit. What are your thoughts on having that piece of foam behind the pelvis on the right?
Yeah, I'm feeling like more comfortable when I
More comfortable.
More comfortable.
And and what do you do for a living?
Driving.
You drive for a living.
Yeah.
So I think that what you'll find is that this will be very helpful to you. And that foam is called craft foam.
Okay.
And it is 5 or 6 millimeters. 6 millimeters is the same as 1/4 of an inch.
Okay.
Okay, I'll cut you 4 pieces of that. You can buy a sheet. It's like a sheet of paper, and you cut it in half both ways, and you'll have 4 pieces. So,
Okay.
one in your home, in your car, one at work, and well, I guess you have a couple of extra.
Okay.
Okay, and so, when you see other practitioners and they say your pelvis is out of place or it's out of alignment, out of adjustment, I need to do something to correct it, that's not the issue. That is not the issue. And we could do a CAT scan and evaluate it in all 3 dimensions, called a 3-dimensional CAT scan. And you could actually even print it. You could hold your pelvis in your hand, and then you could do measurements, and you would find out it's made that way.
Okay.
So it's not a problem, okay? It doesn't cause weakness. It doesn't cause instability, yada, yada. Your pelvis is a little bit asymmetrical, like more than 30% of the population. That's in the bone, and you're fully grown. We're not able to change that, but we can accommodate it. And in sitting, it can be more problematic than when you're standing. You have fewer areas in your body to respond to it, to accommodate it, compensate. So I guess that, if you're driving for, say, 2 hours, maybe keep it back there for half of the time.
Okay.
And that's all arbitrary. Make it an experiment and see what works for you. Okay. And then just, I've shown you what to do to maintain normal movement through your pelvis and hip. And so if you go see someone, like seeing someone for myofascial work, and they say, well, your pelvis is out of alignment, blah, blah, blah. You just say, thank you very much. You may treat the muscles, but you're not going to be able to change it. Don't spend a lot of time doing that, and don't take a lot of money, and don't tell me I have to keep coming back, because that's a fixed deformity that they don't understand.
Okay.
Okay? Yeah. Very good. Well, thank you.
Thank you.